Sup guys, Burning Bubble 7 here, and today we're going to be playing some England toenail removal by Surgery Squad. You can check it out yourself, just type in Surgery Squad and loads of different surgeries come out. But yeah, let's just get straight into this. Clearly hand strained. Medical simulation. Surgery Squad.
Hello, and welcome to Surgery Squad's virtual ingrown toenail removal. I'm Dr. Jeff, and I will be guiding you through this procedure today. An ingrown toenail happens when the edge of the toenail grows down and into the flesh of the toe. When this occurs, there is usually a moderate amount of pain, redness, and swelling around the toenail. An ingrown toenail is usually caused when extra pressure is applied to the toe due to shoes that are too tight or too loose. Improperly trimmed toenails, foot or toe deformities, injuries, and fungal issues can also be contributing factors. There are some ways to treat an ingrown toenail at home to relieve some of the pain, but remember that you should never attempt to remove an ingrown toenail yourself. If you're a diabetic and have an ingrown toenail, it is recommended that you go to the doctor immediately.
Okay.
Now that you understand the causes of an ingrown toenail, let's put on our gloves and remove one.
Oh no. Is it going to be
patient is ready, so let's begin by disinfecting the toe.
Dr. Jeff Jardine, whatever that said, I don't know. Too small. There we go. That's enough because it's lagging.
Now we need to numb the toe with a local anesthetic. We'll have to inject the anesthetic in several locations around the toe.
Oh no. There's blood coming out. Disgusting. And last one.
Great. Now we'll wait a few minutes for the toe to get numb.
You need to clean up my blood.
Now that our patient's toe is numb, place the special tourniquet around the toe.
Okay.
This will help reduce the amount of blood coming from the wound. Once you've done that, first, carefully slide one blade of the nail anvil under the affected nail. We're going to go down the nail until we feel a little bit of resistance. Our patient's going to feel some pressure as we cut away the ingrown nail.
Oh no, because it's gone inside his toe.
Great. Take the forceps and carefully remove the ingrown nail.
Oh god. Okay. Oh god, I can't do it. I've made it hang. Ugh! That's disgusting.
It's getting kind of messy in there. Let's clean up that blood.
Yes, let's. Oh no.
See that small bit of pale yellow substance right there? It looks like the patient has a bit of infection in the toe. Firmly squeeze the edge.
Squeeze. Oh, that's disgusting. It's like some feathers come out of it or something. It looks like feathers or something like that. It's disgusting.
That toe is starting to look much better, but we're not done yet. Next, we're going to apply some phenyl acid to the wound. This will help ensure that when you're done inserting the acid, I'll remove the tourniquet and we'll finish up.
Blood. Oh, that's blood in it. Oh, no.
Finish by applying some antibiotic ointment.
Dr. Jeff's cream.
Place it against the toe and wrap it in a gauze bandage.
Alright, there we go. It's doing it for me.
Fantastic job. Since there was some obvious infection, our patient will be sent home with a prescription for some antibiotics. We'll also need to tell our patient to keep the wound dry, clean the wound regularly, and replace the bandage 2 to 3 times a day. While our patient's toenail isn't likely to regrow, his condition is likely to return if he doesn't take care of his feet. This includes wearing proper fitting shoes, properly trimming his toenails, and keeping his feet clean and dry. And that's how we remove an ingrown toenail. You did a great job today. While you're here, try your hand at one of our other surgeries here at surgerysquad.com.
Alright, let's do this one then, because we might as well do another surgery. we go. Yeah. Alright, before you scrubbing. Alright, let's do another one of these because these are quite fun but they're disgusting. Alright, corroborate training and e-learning. At least I got to read it now. Is it? I don't even know what it's doing.
Welcome to Surgery Squad's virtual laparoscopic appendectomy. I'm Dr. Jeff, and I'll be assisting you with this surgery today.
Okay.
An appendectomy is needed when there is a blockage between a patient's appendix and intestine. The blockage develops over time and may cause occasional pain. However, left untreated, the patient's appendix could burst, causing severe internal infection and potentially death. Today we'll be using a minimally invasive technique called laparoscopy to remove our patient's appendix.
Is this in the stomach?
Laparoscopy reduces the exposure of internal organs to contaminants, shortens recovery time, and results in less post-operative scarring.
I just want to get over
Our patient is a female in her 20s that has been experiencing severe pain in her mid-abdomen, vomiting, and a mild fever. These are all common symptoms of appendicitis. Let's scrub in before this gets any worse.
Yeah, let's.
Our patient has already been prepped and is sedated, thanks to our dedicated nursing staff and anesthesiologist. First, we'll insert an endotracheal, or breathing tube, in the patient's mouth and into her throat to help her breathe during the operation.
Okay. There we go.
Since I've already taken care of inserting a catheter into her bladder, we can move on to more important steps.
Okay.
Thanks to the advancements in medical technology, our patient doesn't have to be cut open to have her appendix removed. Instead, we'll strategically place special surgical instruments, called trocars, through small incisions in her abdomen to perform the surgery. We'll begin by making one small incision in her upper abdomen, one in her lower abdomen, and one in her navel, also known as the belly button.
Yeah, it is. Oh wait, we're cutting it. Oh, we are cutting it. I thought we weren't cutting it. Oh well. Wait, what? I just want to get... Oh my god. Oh, there we go. Come on. This isn't working. Oh no. I'm stuck. Come on. I need to move it in. There we go. One more? Seriously? Where is that hand? Oh my god. And that took ages, so I know we'll have to do another one. That one didn't take us long. And even that one. Oh no.
You handled that like a pro. Now we need to pump carbon dioxide gas into the patient's abdomen to obtain a better look at the surgical area.
Okay.
Next, we need to insert our laparoscopic camera
through the umbilical trocar. Oh no.
Images from the camera are projected on our monitor to allow us to inspect our patient's abdomen and confirm that the appendix is infected.
Okay. Oh, what is this? That little pole, I don't even know.
The inflamed and swollen area you see is the patient's appendix. Our next step is to remove it before it becomes an even greater problem for our patient.
Looks like something's travelling through our stomach, but no, it's not.
Using a diathermic instrument which uses extreme heat to cauterize the artery.
Oh no.
The artery is then divided.
It looks like it has a mouth now.
So far, so good. Keep it up. The appendix now needs to be lassoed with a detachable snare. Take the detachable snare and slide it over the appendix all the way to the base.
Oh my god.
Repeat this step 2 more times, placing 2 more loops above the first one.
Oh my. Oh, what? Are they cutting it? They literally just... Oh. Wait, so they cut it and now they tie a string to it to keep it in... Wait, is this meant to be like that? I don't even know. And now we've got to place another string and then we need to cut it. Keep it in there?
Almost there. Now we need to remove the appendix.
Oh no.
Use the scissors to snip between the loops. Notice that when you snip, a little pus comes out, indicating that the appendix is infected. Don't worry about it though, we'll clean up everything. To remove the appendix from the abdomen, place it into this specimen bag and pull it out through the trocar. Now on to the cleanup. We we've inserted a device that sprays saline into the abdomen. Move it around so that everything gets sprayed clean.
There you go, fill it up with water.
With a flick of a switch, our saline is suctioned back into the same device. Finally, we'll remove the trocars and close the incisions with a few surgical staples.
Oh no. Is that paper clips? It probably ain't. But that just hurts so much.
Excellent
I
work.
think it's sewed. I don't know.
The length of the inpatient care and the recovery process
no,
following an
wait, I thought it was
appendectomy
girls.
usually varies based on the severity of the appendicitis and the person's age. Luckily, our patient is relatively young and healthy, and we caught her condition early. She should be cleared to go home within a day if there are no complications. After being released from the hospital, it is recommended that she limit her physical activity to help the tissues heal faster. But she will need to walk short distances several times a day to speed up the recovery process. She should make a full recovery from her appendectomy within 4 to 6 weeks, since her appendix did not rupture. Had it ruptured, a full recovery may have taken up to 8 weeks. And that's an appendectomy. You did amazing. Why not try your surgical skills in another surgery here on SurgerySquad.com?